In addition to that, we might even have mortal wounds. Mortal wounds would be big abdominal structures that are missing from inside their stomach. So say they had a big gaping wound and you have, intestines and stomach all over the place. Maybe you have significant trauma to the head and you have brain matter everywhere. These are going to be definitive signs of death, because if those things are not intact, most likely there's no way that person's going to be able to live without having an actual surgeon right then and there with the table prepped and ready to go, and you were right there when the patient passed away. The other thing that we talk about is rigor mortis. Rigor mortis is going to be the stiffening of your muscles and your bones, and typically you're going to find that in the jaw initially. And so if you were actually able to, on a person that was dead, if you were able to go over and try to manipulate their jaw, very much like as if you were going to place an object in their mouth to assist in their ventilation, which we would talk about later, which is going to be like an oral pharyngeal airway. When we try to actually lift their jaw open, if it's difficult to lift that jaw open and you have no breathing, you have no pulse, they're pale, they're cool, and they have no blood pressure, you're not able to auscultate any of the lung sounds, and then they have that stiffening of the jaw, they're obviously dead. And then in addition to that, this is a word, petrifaction, or decomposition of the body. You guys can also go ahead and look this up. It's better to actually see physical pictures of this versus for me to actually sit here and explain this to you. One of the things that we discuss as far as in the death and dying is that whenever we're going on a particular call or a particular situation where we're involving ourselves in the care of somebody that's dead, one of the things we need to keep an open mind is that there may be a situation in that scene that's going to turn into a medical examiner's case. Now, there's going to be various reasons for that, but these are going to be some things that are going to be helpful for you to kind of keep in mind for when you're on these particular calls and you're interacting with the patient and the family. If you have a patient who is dead on scene or dead on arrival, you need to keep an open mind. If things in the house look suspicious, if the husband or the wife are acting kind of suspicious, if the scene doesn't look right, most likely this is going to be a case that's going to be turned over to the medical examiner. And you're going to utilize your local law enforcement that's with you on the call, and they're going to kind of give you that insight into that particular situation. However, if you feel like something's just not right and something's not clear, you want to be careful on how you interact with that patient in the scene, because at any point that particular scene can turn into a crime scene. So just be careful on moving furniture, moving the body, manipulating different things. As long as it involves, you want to do the least invasive stuff with the patient that's dead as possible, and least amount of movement of objects and furniture. As long as you're able to render care and you're not disturbing things, then it's okay. But if you have to disturb things to initiate care, well then you got to do that. But do the least amount of disturbing of the scene and the situation in the event that it turns into a crime scene. In addition to that, anytime we're not sure of the cause of death, it might be turned into a medical examiner case in a situation where law enforcement needs to get involved. Definitely suicide. If we're coming into some sort of a violent death, that could be something that's staged. Maybe a poisoning, maybe some sort of an accident that just kind of doesn't add up, as well as maybe some sort of criminal act. And one of the most important things that we need to kind of keep note is if we see any of these things, we want to make sure to kind of note that. We want to make sure to not disturb the scene as best as possible, with still obviously providing the care that we need to do, but also keeping note that this might turn into a crime scene, and eventually we might have to go to court and answer based on what we saw and observed. And so we want to be very careful. If you're not sure whether you should move something or do something, ask the law enforcement. But you're also going to want to make sure you remember this scene so that you can properly document it, so that you remember it when you're called into court 5 or 6 years later. When we talk about family members dealing with loved ones passing away, there are different stages of grieving that take place. These particular stages don't always occur in order. Sometimes they do, sometimes they don't. But typically a person goes through each of these different stages during that process of grieving. And again, it doesn't necessarily need to be in order, but by the time that the person has gotten to line 5, which is acceptance, that's going to be the time where the person has really grasped the situation and has accepted it, basically. But when we're called to a scene of a dead loved one or somebody that has passed away, these family members may be in one of these different stages of grieving. And it's really dependent upon that person of how long they take to go through different stages. And again, some people may go through all of these. Some people may skip some. But you're going to see different things in this, okay? And so to kind of give you an example, maybe you show up to a loved one that's passed away, say it's a husband that found his wife dead on the floor. He may be sitting there going, no, she was right here. I just was talking to her. I was just talking to her before she went into the room. She just said she wasn't feeling good. She just needed to lay down. Well, she laid down. So why did this happen? Again, these are going to be examples of maybe denial. Anger. My wife, she always falls. She always falls. And I tell her, she has to be careful. Why does she fall all the time? And she always falls. And yet, I told her this, and it's her fault, or it's my daughter's fault because I told her this, and we were going to get her into a nursing home, and it didn't happen. Or maybe it's a loved one that had an addiction problem. They promised me to change. They promised me they were going to change. We talked to them about this. We talked about this getting into a treatment facility, or we've been in multiple treatment facilities and they didn't get better. Or maybe we're in a situation where we're reacting with these loved ones and they're showing you various signs of depression, putting their hands in their lap, crying, not saying a whole lot, being super quiet. And then last but not least, just accepting it. And again, when that person gets to this idea of acceptance, that may be a little while, and it may not be in our time. So we just need to keep an open mind that no matter what stage these people are in, we need to accept it, and we need to try and be as helpful as possible in those particular situations. And so this is just a good reminder that a particular family member or loved one may be going through these different stages of grieving their loved one that's passed away.